My name is Dr. Grimes, and I'd like to talk to you about a couple alternatives to hip surgery. I'd like to emphasize that a full hip replacement surgery is probably the most effective and the best option for you. But nonetheless, I'd like to let you know about some alternatives to surgery and if it really is something that you'd like to avoid. We have 5 major alternatives: cortisone shots, bone regeneration, cadaver bones, autografts, and stem cell injection. Cortisone shots are basically injections into either the hip or the knee, and they're used to alleviate pain and inflammation and in general get joints and tissues better moving again. They're not normally long-term treatment, but for some people they can be. Um, Bone regeneration is a another option for you. It's a fairly new study, and sometimes when a break is too big or the body is having trouble repairing or regenerating bone, it needs a little help. And so one of the things that we substitute for it to get help is a BMP, or a bone morphogenic protein. So they help your body to regenerate and repair and just ease along those processes that it normally uses to fix up your bones. Another option is cadaver bones. This one is not completely without surgery, but it would not be a full hip replacement surgery. In essence, people can donate bones just like they donate organs, and so we would use one of those bones and put it in replacing one of yours, and it would help to be a framework for more bone to grow. The main problem with this is the possibility of rejection of that bone. An autograft is almost the same thing as the cadaver bone replacement, with the exception that instead of using bones from someone else, the bone is actually taken from inside your own body. There's not a ton of space to take a bone from, but depending on injury and the necessity, there are options for taking bones and moving it to damaged areas. So it's basically the same thing, and the added bonus is that there's a reduced risk of the body rejecting this new bone. The last alternative that we offer is cell injection. So this is where stem cells are taken from other places in your body, normally from bone marrow, and put into the damaged area to help stimulate the natural regeneration and repair processes of your own body. So those are our options for you. If you have any questions about any of these options, or you feel like they would be better rather than a full hip replacement surgery or regular surgery, if you don't want that either, please let me know, and I'd be happy to go more in depth on any of these options if you decide that's the way you'd like to go.